Hello everyone, I am Dr. Divya, Assistant Professor in General Medicine, Shadan Institute of Medical Sciences.
And I'm Dr. Sailaja, Consultant Physician and Assistant Professor in the Department of Medicine at Shadan Institute of Medical Sciences.
Today we are going to discuss about COVID-19 home isolation guidelines and some frequently asked questions. So Dr. Sailaja, what are the symptoms of COVID-19?
If you see in first wave, patients usually presented with fever, cough or shortness of breath and headache or any upper respiratory tract symptoms such as throat pain. But in this second wave, there are varied symptoms. Like a person can present just with a weakness or myalgias or a loss of appetite, fever, throat pain, and even a cold like a running nose, or even can present with loose motions, vomitings, and nausea. There could be a loss of smell and taste, which is equal to RT-PCR test being positive. There can even be only arthralgias, that is joint pains alone. There can be congestion of the eyes and even a weak hand grip strength.
Okay, COVID-19 కి ఏమేం టెస్ట్స్ అవైలబుల్ ఉన్నాయి?
సో మనకి COVID-19 టెస్ట్ చూస్తే అంటే we hear about the rapid antigen test, but it is comparatively less accurate than the RT-PCR test, which is being more accurate and sensitive. But in this second wave, we are likely to miss even positive patients on RT-PCR because they're basically ORF gene, N gene and S gene. So we need to look in even for the S gene in that RT-PCR reporting. But if a patient is positive, then it's fine. What if the patient is negative, that is RT-PCR negative only, kani symptoms are consistent with COVID? In such cases, your consultant physician might advise you for a blood test or a CT test is then required. So usually put WhatsApp lo circulate out undi and everybody, once they have even normal symptoms of cold, they go and get an CT test done. That is very wrong, Andy, because CT done in the first 5 days is usually a normal study. So your physician would take a better call on that.
Okay, what do you mean by asymptomatic cases and mild cases? What are these asymptomatic or mild cases?
Yeah, pulse oximeter, everybody must be knowing about this pulse oximeter. So pulse oximeter lo, when you check for your saturation, when you place the pulse oximeter, place your finger in pulse oximeter, you get two readings. One is the SpO2, which is called the saturation, and the other one is the pulse rate. It's written as PR. So based on your respiratory rate ante em ledandi, number of breaths we take in a minute is the respiratory count. So based on your respiratory rate and the saturation, that is SpO2 levels, we usually grade the people who are COVID positive into mild, moderate and severe. So mild cases lo, the saturation will be above 94 and between 94 to 100, that's what I mean. And moderate cases lo, it will be between 90 to 94, and severe cases lo, saturation will be less than 90. And coming to the respiratory rate, in mild COVID you'll have respiratory rate which is less than 24 per minute, and if it is 24 to 30 per minute, it's moderate COVID. And in severe COVID patients, you'll find respiratory rate more than 30 per minute.
So what are the treatment that you're going to give in mild cases?
So mild, one thing, Andy, when the patient is having a mild COVID is usually either they are asymptomatic, that is they don't have symptoms, or they have upper respiratory tract symptoms, or they can have a fever, with or without fever they can present, but there won't be any shortness of breath, and the saturation in both these conditions will be more than 94% on room air. These people can be asked for a home isolation or home quarantine. Whereas moderate and severe cases, there might be an oxygen requirement might be there for the patient. So in such conditions, we cannot advise the patient to be in home quarantine. Also, people who are high risk, that is more than 60 years of age, or they have any chronic liver or a kidney disease, or a heart condition, or hypertensive patients, obese patients, we don't advise a home quarantine. If we advise home quarantine also, the consultant or the treating physician would have evaluated them properly and then advised. And people who are immunosuppressive patients like AIDS patients, or on transplant recipient patients or cancer patients, they are not advised for a home quarantine.
Okay.
So we usually give asymptomatic treatment in home quarantine. So based on your symptoms, and steam inhalation and salt water or betadine garglings are advised. Here I want to make one thing very clear, Andy. When you are taking your supplements like vitamin, they don't prevent you from COVID or they won't treat the COVID infection. They just help boost your immunity. So మన immunity పెంచడం వల్ల we recover faster. అంతేకాని it won't prevent or treat a corona infection. So that thing everybody should understand. And depending on your symptoms, your doctor might advise inhalational steroid.
Okay, what is this happy hypoxia?
Yeah, whenever we advise for a home quarantine, we always ask for the patient to check for the red flag signs. That is, we ask the patient to check for saturation every almost 2 to 3 times in a day. And especially after 6-minute walk test, under 6 minutes when you walk, మన saturation shouldn't drop 5 points. Say your saturation is 97 on room air when you are at rest, and when you walk for a 6-minute period, and if the saturation is dropping 5 points, that is 93 that is an alarming sign. That is when there could be an underlying pneumonia, or the patient might be turning worse. And the red flag sign, fever persisting for more than 3 days, 101 more on paracetamol. If you're taking a paracetamol tablet, still you're having fever more than 101 degrees Fahrenheit, or more than 103 without a treatment. Or if your persistent cough is there, and if cough is worsening, or if your symptoms are worsening. So these are all the red flag signs. That is when you need to inform to your doctor. Happy hypoxia is when you check your saturation, the saturation might be less than 94, but then the patient won't feel breathless. So that is a happy hypoxia state. But there are very likely to deteriorate very faster, especially in this second wave of COVID. So that is why saturation checking is very important at home. So we spoke about the saturation, we spoke about the treatment part of mild COVID. So can you just tell me about the home guidelines, home isolation guidelines, doctor?
So once you turn RT-PCR positive, and then immediately you have to isolate yourself. ఒక్కొక్కసారి రిపోర్ట్ రావడానికి డిలే అవుతుంది, 2 to 3 days పడుతుంది. సో అలాంటప్పుడు మీరు సిమ్టమ్స్ వచ్చిన వెంటనే మీరు ఐసోలేట్ అయిపోయి ఉండాలి. మేక్ ష్యూర్ దట్ ద రూమ్ ఈజ్ వెరీ వెంటిలేటెడ్, విండోస్ అన్నీ ఓపెన్ చేసి ఉండాలి ఫర్ క్రాస్ వెంటిలేషన్. వేర్ ఏ ట్రిపుల్ లేయర్ మాస్క్ and discard your mask for every 8th hourly. And before you discard your mask, first you get a 1% sodium hypochlorite solution. So pour the solution over the mask and then discard it. If there is any caregiver entering your room, both you and the caregiver should wear an N95 mask and maintain at least 6 feet distance. And also clean the doorknobs, the table, everything with this solution. Next thing is nutrition. Nutrition is very, very important. So take a rich protein diet and fruits and vegetables. Also hydration. Make sure you take lots and lots of water. ఎందుకంటే ఈ COVID-19లో మనకి థ్రాంబోసిస్ రిస్క్ అనేది ఎక్కువ ఉంటుంది, అంటే బ్లడ్ క్లాటింగ్ అయ్యేది. సో ఇఫ్ డిహైడ్రేట్ అయ్యింది అనుకోండి బాడీ, ఇట్ విల్ బి ది అడిషనల్ రిస్క్ ఫర్ థ్రాంబోసిస్. సో మేక్ ష్యూర్ యూ హైడ్రేట్ యువర్ సెల్ఫ్. నెక్స్ట్ ఈజ్ మెంటల్ హెల్త్ ఈజ్ వెరీ వెరీ ఇంపార్టెంట్. సో COVID-19 వచ్చింది, RT-PCR పాజిటివ్ వచ్చింది అనగానే do not panic. Not everybody will end in mortality. So the recovery rate is very good. And also చాలామంది హోమ్ ఐసోలేషన్లోనే దే ట్రీటింగ్ రికవర్ అయ్యి దే గెటింగ్ బెటర్. సో స్టే అవే ఫ్రమ్ సోషల్ మీడియా ఆర్ ఎనీ కైండ్ ఆఫ్ న్యూస్ దట్ ఈస్ ట్రిగరింగ్ యూ. And do meditation, do some breathing exercises, do anything that relaxes your mind. Okay, next is charting of your symptoms is very very important. So మీ symptoms అన్నిటిని డే వైజ్ యూ హ్యావ్ టు చార్ట్ ఇట్. అండ్ ఆల్సో beside that, make a chart of SpO2 levels, your respiratory rate, your heart rate, your BP and your sugar levels. So sugar levels అనేవి ఎవరెవరు చెక్ చేసుకోవాలి? If you are a diabetic or pre-diabetic, or if your doctor has put you on steroids, you have to check your sugar levels. And also if you are hypertensive, or even if you are not hypertensive also, you have to keep checking your BP. If it is going low or if it is shooting high up, you should immediately inform your doctor. And SpO2 levels, as she already mentioned, you have to get a pulse oximeter, place it on your middle finger. If you are having any nail polish, preferably remove it. మీరు ఒక రెస్టింగ్ స్టేట్లో ఉండి దాని మీద మీకు 2 రీడింగ్స్ చూపిస్తుంది. వన్ ఈజ్ యువర్ SpO2 లెవెల్స్ అండ్ వన్ ఈజ్ యువర్ హార్ట్ రేట్. సో ఈ 2 లెవెల్స్ మీరు అందులో రాసుకోవాల్సి ఉంటుంది. అండ్ రెస్పిరేటరీ రేట్ షీ ఆల్రెడీ టోల్డ్ యూ, 1 minute ఎంత మన బ్రెత్ కౌంట్ అనేది యూ షుడ్ మేక్ ఎ నోట్ ఆఫ్ ఇట్. సో ఆల్ దీస్ థింగ్స్ యూ హ్యావ్ టు రైట్ డౌన్. day wise you have to write how your symptoms are progressing, or if any new symptoms are coming, if your symptoms are decreasing or increasing, everything you should make a chart of it. And whenever you are having review with your doctor, you have to tell him like how are these things going, if you are improving or if you are deteriorating. So as you already mentioned, రెడ్ ఫ్లాగ్ సైన్స్ అనేవి ఉంటుంది. సో ఈ చార్టింగ్లో ఇఫ్ యు ఆర్ సీయింగ్ దట్ యువర్ రెస్పిరేటరీ రేట్ ఈస్ బీయింగ్ మోర్ దాన్ 24, or your saturations are falling below 95%, or you are having your tachycardia, that is heart rate being more than 110, or other things that she mentioned like the fever persisting, breathlessness and persisting cough, and also if you are having any discoloration of your lips, or you are having decreased urine output కానీ, లేదా if you are having altered mental state like ఒక mental confusion ఉండి, లేదా decreased alertness, decreased arousal, ఇలాంటివి ఏవి ఉన్నా సరే యూ షుడ్ ఇమీడియట్లీ గో టు హాస్పిటల్ అండ్ సీక్ యువర్ డాక్టర్స్ అడ్వైస్. అండ్ ఆల్సో don't self-medicate, don't copy others' prescriptions. This is a common thing that we are doing. See, the other person kuda same symptoms vachayi, so I'll just copy what all is taking drugs anedi. That is a very wrong thing. Every patient is different. You might be having some other conditions, he might not be having those things. So your doctor is the best person who knows that. He might give you some drugs or he might not give you some. So do not copy others' prescriptions, do not self-medicate, do not follow blindly whatever you get on the social media or WhatsApp and all. See, your doctor is the only best person who will treat you. If you are having any doubts regarding your treatment, then you take another doctor's opinion, but not the social media's opinion.
Yeah, here I would like to add another point. In WhatsApp, if you see the treatment, apart from your supportive treatment and your ivermectin and all, there is another thing which is circulating. People are starting on steroids as well as blood thinners. Steroids and blood thinners are not indicated in mild COVID cases, Andy. Only if your saturation is dropping down, or on 6-minute test if there is a 5-point decrease in your saturation, or if your symptoms are worsening, then your consultant physician might think of starting you on a steroid, that too on a low dose steroid. So please don't start. Only if your blood D-dimer is raised, only then blood thinners are advised. And rest of your medication, if you're a diabetic or if you're a hypertensive, they have to continue. You should not stop your other medications. And sugar levels monitoring is very, very important in COVID cases. So consult, as she said, please chart down your sugar levels and then please consult your physician, and he might increase your dosage of oral anti-diabetic drugs, or he might put you on a short course of insulin. So based on that, he will treat you accordingly. Thank you. And I would also like to ask you, is retesting required after home isolation, and when to end the home isolation, doctor?
This is a very good question, and it's a very common question. So most of the people after this 14 days isolation, they're going and getting this RT-PCR done again. See, it is not needed to get it done. If you are home isolated for 14 days and if you are being symptom free in the second week, or for more than 3 days if you are symptom free, and if you finish your isolation, then you can go and mingle with your family without getting this RT-PCR test done. The problem is the RT-PCR test can also pick up this dead viral debris. సో దానివల్ల ఏమవుతుందంటే మీకు మళ్ళీ పాజిటివ్ వచ్చే ఛాన్స్ ఉంటుంది టెస్ట్లో, బట్ యాజ్ సచ్ ఇట్ ఈస్ నాట్ ఎ పాజిటివ్ ఇన్ఫెక్షన్ ఇన్ యువర్ బాడీ. సో అది మీరు వేరే వాళ్ళకి స్ప్రెడ్ చేసి లేదు, మీ బాడీలో కూడా ఇన్ఫెక్షన్ ఉండకపోయినా మీకు వచ్చే ఛాన్స్ ఉంటుంది. సో దట్ ఈస్ వై ఇట్ విల్ అన్నెసెసర్లీ క్రియేట్ ప్యానిక్. So once you finish this 14 to 17 days of isolation, retesting is not needed.
Thank you, doctor, for clearing our doubt. And I would like to know, what is this third wave and when can we expect this?
Yeah, థర్డ్ వేవ్ అనేది ఈ కోవిడ్ వైరస్ అనేది ఎప్పటికప్పుడు అది మ్యూటేట్ అవుతూ ఉంటుంది. సో ఫస్ట్ టైం అయిపోయిన తర్వాత మ్యూటేట్ అయ్యి వచ్చింది మనకి సెకండ్ వేవ్, ఇప్పుడు కూడా మళ్ళీ మ్యూటేట్ అయ్యి థర్డ్ వేవ్ రావచ్చు. సో వెన్ విల్ ఇట్ కమ్ అనేది వీ కాన్ ప్రిడిక్ట్ ఇట్, బట్ it can come, the possibility is there. So what can we do about it? The same thing we have been doing always: social distancing, masking and sanitizing. These are the 3 things which will prevent you from these waves.
Here I would also like to mention about the vaccination. When a person needs to take a vaccine, say you're tested COVID positive, so when can you receive a vaccination? So basically you can receive your vaccination 3 months post your recovery. And if you're taken your first dose and then you have got the COVID infection, even then 3 months after your recovery is the ideal time for vaccination. There is no requirement for getting tested prior to vaccination. Also, if you are on ICU for some other reason other than a COVID infection, then 4 to 8 weeks is the ideal time post the recovery. And when can if you have received monoclonal antibodies or convalescent plasma therapy for your treatment of COVID infection, in such cases, 3 months after your discharge from the hospital is the ideal time for vaccination. So, and first 5 days of your illness, the first 5 days from your symptoms steroids should be avoided, because usually the first 1 week in the 2 weeks of COVID period is the viremia phase, wherein the virus replicates, and the second week is the pulmonary phase, wherein there is a chance that likely a patient can deteriorate. That is when a repeat CT might be required if the symptoms are worsening. Only in such cases the patient will be put on steroids.
Exactly. So first 5 days, do not use steroids and do not get CT scan done unless your doctor tells you. So day 6 to day 12 is the most crucial period. So that is a time where we call this impending cytokine storm can be seen. I mean, if you are having these red flag signs, immediately contact your doctor. It could be cytokine storm. He might advise you any blood test done or any blood test required or CT scan to be done in that period.